So when the water crisis happened, I actually wasn't living here. I was living in Ohio, and because I had moved away for a job. And when this happened, I came home because my educational background, part of my professional background, hobby background is related to chemical safety work. So I have a lot of knowledge and expertise in that area. So I came home because I felt like I could be helpful to the community in navigating through this really kind of scary crisis. So I did a couple of different things. I was hired by West Virginia Free as a consultant to hold women in water listening sessions, and what we did with that was essentially, invited women who had suffered from the water crisis to come together and just hear what the concerns were, and make recommendations of what they wanted to see happen or information that they needed, and we just documented all of this and compiled a report on it, which has been used by Harvard and Georgetown amongst other folks to look back at the situation to figure out how things could be done differently. So that was one thing I did, and then also because I have been through many chemical incidents in my life, I sort of knew what the experience was, what emotions people go through. It's a very disempowering feeling. So we held community action planning meetings where one of the first ones that we did was there was a town hall meeting held by WCHS, and afterwards we pulled people together and said, what do you want to see happen moving forward? I would say 150, close to 150 people participated in that. It's one of the biggest turnouts I've ever seen at a meeting. And we continued to meet, continued to engage people, and out of that formed Advocates for a Safe Water System, which is a very highly organized and successful group that's moving forward in the water crisis. And raising awareness around chemical safety issues. I mean, that's another thing that I did. Helped West Virginia Free, look at what some of the potential reproductive health consequences could be as a result of this chemical, or recognizing that we don't know, we don't have the scientific basis to understand that. Yeah, no, I was like, it's a big deal when I heard that people were smelling something in the air on Facebook, and people were complaining about it in Charleston, and it wasn't just one person, it was multiple people, and it was early in the day. So I knew that there was a bad chemical leak if that was happening, because anytime you smell something, there's a leak. Anytime you smell something, there's a leak. You shouldn't be smelling it. And the truth is that not all chemicals have a fragrance or have a low odor threshold to be able to smell them. So we were actually really fortunate there. So I knew immediately that something was wrong, and I was very concerned. And then I found out that it was the Freedom site that was very close to the water intake, and I just could not believe that they weren't turning off the intake. And then I could not believe that there was no shelter in place or no, some sort of massive communication to people to, not be drinking the water. To me, it just made a whole lot of common sense to have done that first thing, Granted, I don't understand the complexities of what it means to turn off a water system for 300,000 people and, what the repercussions of that are. But it seems to me that if that had been done immediately, sort of like what my common sense told me, that we would not have been in the situation that we were in. So I was very freaked out very early on. And it's probably because I have a heightened sense of awareness around chemical disasters and how they happen, and I knew that one was playing out. I was ready to hop in my car that day and come home, and I held off because I couldn't quite figure out how I could be the most helpful. So what I did was I wrote an op-ed about the Chemical Safety Board recommendations and how, if they had been implemented, would this instance have occurred. So I wanted to embed that in the public conversation. So that's what I did from afar. But also the first thing I did was the very first night that it happened was I went and I filled my trunk up full of water because I didn't know how long this was going to be. And one of the first phone calls that I had back home was a friend who had two twins, young twins, and she called me and she said, Maya, I just bathed my twins in this water. Are they going to be okay? And it was just really, you know. So at that point, it was just, I don't know, it just really hit home even more. And just the things that you take for granted. It's just, so it sort of hit me on that sort of basic survival level, but I had access, so I was okay.
And when you're saying you have access, are you referring to people who couldn't afford to buy water or couldn't find water?
Yeah. And I think that there were a lot of gaps in the emergency response there. I think that emergency responders did a great job. I really do. There's no script on how to deal with this situation. I think that there were gaps, and I don't think that you're always going to catch every gap, but it's always, as one of my friends says, the last, the least, the lost, and the left out. It's like those are the people that always end up suffering the most, and people who don't have transportation to be able to get to water buffaloes, and then the water buffaloes were filled up with what people consider to be the tainted water. So then the trust was broken. So and they weren't delivering bottled water because it was too expensive. So yeah, that was really scary for a lot of people. And I actually went to a housing project and did one of our Women in Water listening sessions, and they at one point in time did have water there, but then they moved it away. And then when that happened with the water buffaloes, people didn't trust water that didn't have a lid on it. So people were either spending money that they didn't have to be able to purchase water, or they were using the water because they didn't really trust either source. So yeah.
Yeah, that's one of the things I look at is the different miscommunications or missteps that cause distrust.
Yeah.
That was a big one.
Oh, there were many of them. There were so many of them. And it was a shame because I think that it's, yeah. I know that all of the people who responded did the best job that they could. They felt like they were really doing the best that they could. And, because I sat in a room full of emergency responders whose job it was their responsibility to navigate this, and they really thought that they were doing the best that they could, and they did. It's always hard when you feel like you're doing your best and people are still left out or there are still major gaps. I mean, I found out through most of it through Facebook, and I found out the miscommunication that was happening through Facebook. It was amazing. But I got most of mine through Facebook, and I saw that people were filling up their bathtubs because they were saying that they were going to turn off the water and they wouldn't be able to flush the toilets. And I was telling people, no, that's a bad idea. You don't want to expose yourself. But yeah, there was no ring down that I'm aware of. Not the shelter. I call it the shelter-in-place alarm, but it's really just the emergency alarm. Didn't go off. But the reason for that, I mean, I can see the emergency responders' point of view that we're so used to air issues here in the valley, not used to water issues, that it didn't connect that was how you use that alarm. So. A lot, and then just the constant miscommunication, and I think with the way that news travels these days, it's hard to filter out what's the official line and what's what is somebody just telling me. So that was really interesting when Dr. Welton came in, and he did the flushing protocol. Did you do the video for him for that? That was so great. Because, he was questioning the flushing procedures, and, nobody in the government was taking that up. And we were trying to get them to pay attention. And I remember I was sitting down with him and the press secretary for the governor and Rob Goodwin. We were all sitting there trying to convince them, look, you need to think about this flushing protocol because it's not been appropriately, considered. And, it was never changed. So unfortunately, what Dr. Welton put out wasn't an official line, but it would have been more helpful to the citizens than what was actually out there. So then,
And no one would tell that story in the media before either. Before I was there, CBS News was interviewing him.
Mm-hmm.
They didn't say anything about that. He was trying to tell them, you need to tell people.
Right. It was such a confusing time. So unbelievably confusing. I am so thankful, so unbelievably thankful that he came. He was exactly what we needed. When I was still in Ohio, I think I came on maybe the third or the fourth day. But on the second day, on January 10th, I was calling scientists that I knew, begging them to do water tests, and they didn't necessarily know exactly what needed to be done, or, because they didn't know how to test the chemical at first. There was no test that was even developed. So when he showed up, I was just so thankful because I knew, based on my past experience, that we needed to capture the information immediately in order to credibly document what was really being experienced by people. So I've just been unbelievably thankful for him the entire time. Because he, I feel like he's asking the questions that need to be asked, and he's not sugarcoating things. And I think he's saying, just really laying out the data. And sometimes I feel like the way that the data is laid out is in a way that maybe calms fears and doesn't really tell people the absolute truth. So I appreciate him very much. Ten people that I know of. So I think it's 4 families. One person in his family who was just shaken to his core of how response was handled, and concern over his family's safety, left. And he wasn't from here. He had actually moved here for a job, so he left, and he and his family. Same thing happened with another friend of mine. One person who she had a negative health consequence from inhalation, and attributes her adult onset asthma that occurred right after she experienced the flushing process to exposure of the chemical. She'd never had any of those kinds of issues before, and her children also had issues, and as a direct result, moved. And then I have another friend who was also experienced severe negative health impacts at work as a result of flushing, and so much so that it was pretty debilitating. So that's 10 people that I know of. I also know of a friend of mine who was a very successful chef in the area, who sort of had a relationship of living here and not living here, but she and her family were actually getting ready to move back, and they had just put a lease on a historic sort of restaurant here in Charleston that people would have been very excited to have, come back to life. They had just put a lease on it, but she also had just recently had another child. And when this happened, she just said, "There's no way, I can't risk my family's life." So they ended up not moving here. And the thing that concerns me is that I feel like the people who experience negative health impacts, they're going to be lost in the cracks. And their experience was so significant that they had to leave. So how many other people out there like them, are there? Yeah, the long-term medical monitoring, it sounds like they're doing just a blanket look at the state, which I feel like is a mistake. I feel like this incident, as I feel like there have been many other incidents that have occurred and that are ongoing in the state that merit long-term medical monitoring. But this experience was a chemical that was grandfathered in under a law that didn't require any kind of testing prior to being on the market or in order to stay on the market to know what the human health effects or the effects to the environment would be. And this is the first time that such a massive group of people, over 100,000 people, experienced symptoms of exposure, according to the study that was done, according to a couple of studies that were done locally, piecemealing information as best as possible. So knowing that many people experience symptoms of exposure, we don't know what the reproductive effects are. We don't know if it's a carcinogen. We don't know, any sort of mutagenic effects are. Yeah, none of that has been done. So I think it's a real opportunity lost, but it just kind of makes me think that if the same thing happened in Washington, D.C. or New York, do you think the studies would have been done? I do. But, I just think that we as a population don't matter as much, it seems like, here in West Virginia. So,
why do you feel that way?
There's not a whole lot of money in West Virginia, honestly. I think that is a huge thing, and as a result of not having money, I think that there's not as much power. It happens over and over. Because I feel like we're not addressing the root causes of these incidents. So the work that I'm doing now is really looking at trying to address some of those root causes and changing the safety culture that is enabling these kinds of incidents to continue to occur. Maintenance is a huge issue for a lot of facilities, and it's one of the major cost-cutting measures that I've experienced through my research. It's about the culture of safety, because if you have a plan in place, yet that's not what the standard, that's not how you practice in reality. Like looking at the 2008 incident, one of the things that happened was that, first of all, the safety protocol had not been updated for the new system that was in place. And then one of the safety mechanisms that was in place, workers were told to bypass in order to get production up to speed the way that it needed to. So really following procedures that are in place and ensuring that procedures are in place is of utter importance, especially when you're handling some of the most dangerous chemicals on the face of the planet. So the United States Chemical Safety Board, they are a federal hazard investigation board, and they investigate chemical disasters across the country. And their role is to make recommendations on best practices of how to prevent these chemical disasters from happening. And we have one outstanding recommendation from the Chemical Safety Board from previous incidents that we would really like to see put in place, because we feel like it would help with that underlying issue that causes these kinds of incidents to keep occurring. So that's what we're working on. Unfortunately, our government hasn't really picked up and sort of taken the ball and moved with that recommendation. So essentially we're stepping in and saying, okay, we want this to happen, and we're developing a roadmap on how to make it happen. Step by step, this is what needs to happen, and it's called a chemical release prevention program. And so we are holding a series of stakeholder meetings and public input meetings and educational sessions to help craft this roadmap on what this program could and should look like here in the Valley. We have engaged right now the Bureau for Public Health, the Kanawha Trust and Health Department, the West Virginia Department of Environmental Protection, the Kanawha Putnam Emergency Planning Committee, and but what we're missing is industry. Industry has denied they don't want to participate in this process, and which is really disappointing because it's going to be very important to have their buy-in and their participation in order to make this a plan that's actually going to work for everybody. And that's really our main goal. So we're still working on that. This is the first time. I honestly think that one of the only reasons why I'm able to sit here as the executive director of my organization is because the water crisis happened. It raised such attention that other incidents in the past happened that we were lucky to be able to get funding. People were paying attention who had money and recognized the significant need that is here for advocacy. But, here we are a year later and it's not in the national news, and you can't smell it in the water anymore, you can't taste it in the water anymore. People have basically resumed their daily lives, and that's kind of the cycle of chemical disasters in my experience. People get really outraged when it happens, and then when when the smell goes away and you can resume daily life, if you're lucky enough to be able to, then things change. So if there weren't groups like ours out there, then the same problems will continue to happen. And we hope that we can make a real difference. That's the goal. Do I think that it's going to make us be able to live for another 30 or 50 years, or to live through whatever it is that's coming in the future? I don't know that, because it's really hard to make any sort of substantial change. But I'll be damned if I'm going to give it my best and try to make as much change as possible while I'm here.